Good evening and happy decade. It's January 2010 and the United States is having quite a debate. The debate, of course, is about what's going to happen to our health care, to our nation's health, to my patient's health. Many doctors are very concerned, as are our patients, about the legislature that is in front of us. Let me tell you why that legislation is not good and what I suggest we might do. This legislation is not good, and I have read the bills, by the way, all of them, probably too much time on my hands, for several reasons. First of all, it fractures the patient-doctor relationship. The reason that this happens is, for instance, for those patients who have Medicare Advantage, in many states, excepting in Florida, that Medicare Advantage could go away because the funding is going away. What's going to happen to that doctor? What's going to happen to that patient-doctor relationship? It may not be around in the years to come. Secondly, while the government seems to think that things are going to go along hunky-dory, if you will, what do you think about those patients, for instance, in Arizona or across the world, who used to come to the Glendale-specific Mayo Clinic? That clinic is no longer going to accept Medicare patients. Those patients who have Medicare, who have a relationship with their physician there, will now be subjected to paying cash, 100% cash, for their visit. I have a better idea. Many of America's doctors have a better idea. And that idea is about private contracting. Private contracting is allowed in this legislation outside of public programs. But why not in public programs? Why not assume that the government might want to publish how much they're going to pay for a doctor visit or a specific procedure, let the doctor charge what he might charge, and then let the patient contract with the doctor for the difference, or up to the difference, allowing the physician, for instance, to give that care away should the patient not have enough money to pay in full, or for the physician to get paid what he believes the service is worth. Moreover, why not encourage doctors to compete among one another? You know, I love being the best doctor in town, or at least thinking I am, and I need to work for it. And I need to work for it for my patients. And I need to do a better job if my patients are going to pay me, and I need to be proud of that. And if I don't do a better job, or someone down the street can do a better job for less money, then I guess I better go back to the drawing board. But somehow that's all right. Restaurants compete. Nordstrom's competes with Macy's. Morton's competes with Ruth Chris Steakhouse. McDonald's competes with Carl's Jr. Don't you think that each of those facilities is better because they compete? Hospitals should compete. Doctors should compete. It should not be one price for all, one quality for all. Absolutely not. Our patients deserve the opportunity for their doctor to do better. And I think that all doctors should take advantage of that opportunity. We've pretty much resigned ourselves to the fact that there won't be tort reform, so I'm not going to speak about that. But I would like to speak to the idea of patient privacy. This legislation really subsumes my patient's privacy. As a matter of fact, HIPAA, and it's very confusing, but HIPAA actually does not protect our patients. As soon as a patient signs up with an insurance company, they basically have given away their rights to their privacy. The government is entitled to know every drug value in terms of the laboratory tests. They are deserving of knowing the radiology results. They deserve to know every diagnosis because they're paying the bill. And there goes your privacy. Now, while you may not assume that to be a big problem, I think that it could be a big problem. Could be. And I'm certainly not willing to take that chance for my patients. That's why I think we need legislation that guarantees our patients' privacy. It's none of the government's business, nor is it your insurance company's business, about what happened when we talked, when the door to my exam room was closed. 4 walls and a closed door. That's among us, patient and doctor, and should not include the government, and should not include the insurance company. I think that there are many ways that we can make care much more affordable and much more accessible. I'd invite you to read a Wall Street Journal article that was published today about USA #1. In fact, we've heard for the last time, I hope, about the United States being 37th in the world in healthcare. It's just not true. We're number one. We cure more cancer. We take care of our cardiac patients better. We serve our patients faster, more effectively, and more efficiently. I will ask you, the American public, how much is your life worth? What is your health worth? And your health is your life. While I certainly can understand why you don't want to pay the horrendous premiums that are going to come as a result of this legislation, because you don't want to pay for the health care of the guy down the street, I don't blame you. But I think that you are willing to invest in your own life and your own health. Therefore, I think that you should invest in American health care, your relationship with your doctor, and go into your doctor's office with an expectation that you and she or he are on the same page, there to make a better day, a more profitable, a more productive day for you and for your family. That's what the American healthcare system is about. It shouldn't be about what kind of insurance do you have. It shouldn't be about filling out forms. It shouldn't be about protocols that are assigned by some administrator in Timbuktu or Timbuktu 4. It should be about you, our patients. You need to find a doctor who's willing to work with you, spend the time with you, and give you your money's worth. You know, the healthcare arena is the only place where patients don't expect to get your money's worth. I think your life is worth more. I think you do too. I invite you to encourage your physician and your friends to call your legislators this week and tell them why this legislation is wrong. Wrong for you and wrong from the American public, and why you are willing to invest in your life and in your health. Let's do it together. Let's create legislation that does allow for insurance companies to compete, for insurance to be sold at an affordable, reasonable price, where insurance is an insurance and actuarial bet to protect you from the financial crisis that could come as a result of some catastrophe to your health. And let's give you the platform for your own day, the platform to make decisions, choices that are best for you. Thank you very much for listening. Now, go to the telephones, go to your email, contact your legislator, contact your doctor. Let's get this done together. It is about us. It's about our life. It's about our future. Thank you so much for listening. Again, I'm Marcy Zwelling. You can visit me at z-doc.com, or you can email directly at marcy@choicecare.md. Have a wonderful decade. Go 2010. Bye-bye now.